Welcome back. What a video, huh? I saw that for the first time with you. As a Marine, I can tell you it's just awesome to know that that kind of capability is here for our warriors. I'm here now with Dr. Jean Ma, Medical Director for Tri-City Emergency Medical Group, and Dr. Frank Corona, Chief of Staff-elect at Tri-City Medical Center. Doctors, thanks for joining us.
Thank you for having us here.
Yeah, glad to be here. Thank you.
Must make you feel great to be part of that story in a way.
It does.
And let me, as a Marine veteran, thank you for it right now.
Well, thank you.
It
Glad
means
we're
a
able to help.
tremendous amount. The emergency department at Tri-City is one of the largest in the county. So can you tell us what that means in terms of what you're offering?
That's correct. We've gone in the last half decade from about 45,000 patient visits per year now to a little over 70,000 visits. But despite a pretty tremendous increase in that volume, our average wait times have decreased now to 43 minutes. And I think we've been able to do that through integration of some business solutions with respect to operational efficiency. We've added 11 emergency room beds and also 6 fast-track beds. And what those 6 fast-track beds allow us to do is to take those who have less severe illnesses or injuries and see them in a separate rapid care area, all the while reserving our 41 emergency room beds for those that really do need that critical care level bed and emergency patients.
Do you expect to see continued growth along those lines?
We do. We've seen a little bit of a flattening out over the last year, but the trend has been continuously over the last 15 years, a continued growth, so we certainly expect that.
Now, regarding wait times, is there a standard that you're working to, or are you just continuously trying to lower that?
No, we're certainly continuously trying to lower that. 43 minutes, we're very pleased with that, but it's 43 minutes longer than we really want. We'd prefer that there not be a waiting room, that a patient goes straight back to a bed, and that's what we're trying to achieve. We've got some phenomenal nurse managers in our emergency department that have helped us do that. We've also integrated some technology that's helped us do that. We've developed care sets that are now being nationally emulated, in which the prior process, for instance, for a heart attack, somebody might come in and a physician would see the patient, order the test, put it on paper and hand it to the secretary, and he or she would then have to order that through various systems and make several phone calls. For a heart attack now, we've developed care sets in which one push of a button, a physician now orders an entire care set such that the phone call goes automatically to the heart specialist, the heart cath team, which is the special team heart team that you saw in the video earlier, on the pictures earlier, and designates a phone call to the lab technician, the EKG technician, the radiology technician to come, and everyone knows their role such that we've been able to, as Mr. Dawkins alluded to earlier, get some of those national benchmarks being 90 minutes from the time you arrive in our department to getting that heart attack, the blood vessel opened up, down to as low as 30 minutes. And those are the type of operational processes that we think are driving shortened waiting times for our patients.
So it's a package of people and tests that's standardized for the common things that you have, that the common ailments that people show up with.
Exactly.
Interesting. Now, in connection with this technology, you are you posting wait times on your website? Is that a real-time issue, or is it just like an average that you can expect?
Right. We're very excited about the new website that is being developed for the hospital, tricitymed.org. And on that website, I believe the rollout is anticipated to be sometime in March. There will be a banner up front such that our patients will be able to look online and see our nurses in the emergency room will periodically update that so that an individual will be able to know what they should anticipate as the current average waiting time.
Now, and that's in March?
Yes.
And the website again?
tricitymed.org.
tricitymed.org. Now, you have other new technological advances. I see scribes and electronic medical records.
Right. We have a whole host of technology that we're very, very excited about through the generous support of private philanthropy, the foundation, and our administration. They've put a lot of technology in our department to allow, at Tri-City Emergency Medical Group, we only hire and staff with board-certified emergency physicians, meaning these are physicians who have a tremendous background in critical and emergency care, but they need to have that special technology to deliver the kind of care that they've been trained to do, and we have very state-of-the-art ultrasound machines, a 64-slice CAT scanner, which was the first of its kind in an emergency department in the county. But alluding to what you just alluded to, which was utilizing our electronic medical record and scribes, the problem that we're seeing nationally is that you're seeing a significant reduction in productivity, meaning physicians are having a hard time keeping up with generating this record, yet seeing patients. And you're seeing about a 25% reduction in their ability to do so. When we started this system, we opted to go with utilizing a program of scribes, and this was just written up, and we were given some accolades for it in an emergency medicine management magazine nationally recently about our utilization of scribes, because while the trend is for lower productivity, ours has gone up, which has helped us see those growing numbers of patients while reducing our waiting times. And what our scribes do is they allow us to do what we do, which is to spend our time with our patients. I'm no longer walking into a room buried in a chart and taking the history. The scribe is doing that in the background. I can sit down and listen to my patient. I can talk to the patient. I can examine the patient, go back, enter my orders, but it gives me the time to go back and make sure that my patient is comfortable, that their pain has been addressed, that they have updates on what's happening during their stay in the emergency department, and also that before they leave, they have their questions answered. And I think that culminated recently in the last quarter. Our Press Ganey scores for our emergency department physicians, all 43 physicians, almost universally scored. We're ranked throughout the county as for our customer service satisfaction scores, and universally we're at 99%, meaning our physicians, 43 physicians, at the top 1 percentile in the county, which I think is the most, of all the metrics we talk about, that's what I'm most proud about, because what it says is we're doing the right thing with our processes, but we're integrating technology, but remembering that the human touch is probably going to be the most important component of all of this, and we can't lose sight of that.
So you're finding ways to be more effective and more efficient at the same time.
We like to think so.
And Dr. Corona, I think that's probably what the barcode system that you were going to talk about also tries to do.
Right, that's part of the National Patient Safety Program or initiative. Medication errors are a big challenge. Going from the point where the physician enters an order to where the nurse administers the medication, there's a series of processes and points where errors can occur. This bedside barcode medication initiative reduces the number of errors. Surveys have shown that it can reduce the errors by 80%. And our hospital is one of only 20% of hospitals nationwide who has initiated this process. It's a process where the nurses use a device with barcode technology to match the medication to the barcode on the patient's identification band, so that she can confirm that the patient is getting the right medication, the right time, the right dose. Technology also has checkpoints, so it verifies that it's the medication doctor ordered, the dose is appropriate for the condition that it's being prescribed for, checks for medication interactions, confirms patient allergies. So it checks all these number of processes where errors can occur and automates it in a way so that the likelihood of any of those errors occurring is much smaller.
You know, Doctor, you're the last one up on our list of guests, and you have the advantage of being the one who gets remembered because you're last, but you have the disadvantage of being the one that gets cut short. As we talked about a lot of interesting stuff, and I know you have a few things to cover, but time just doesn't allow it.
I understand.
So I want to thank you two for being here. I want to thank all of our guests. Technology in the medical field is expanding dramatically as a whole. Tri-City Medical Center is definitely staying updated on all of these new trends and offering them to the community. Again, I want to thank our guests. I want to thank you for watching The Voice of Oceanside. Don't forget, you can go to koct.org and watch this program and other KOCT programs on demand.